Good afternoon, Minnesotans. Thank you for taking time out of your busy day to join us. And I think after a year of us being together at different occasions and us trying to do the best we can to get out the information around the COVID-19 pandemic, today's a day that all of us have been looking for. I'm going to be joined today by Lieutenant Governor Flanagan, by Commissioner Malcolm, and then you're going to hear from three healthcare leaders, folks who lead, and they themselves have been on the front lines of dealing with COVID-19, but have been partners from the beginning, and that's what this has been, Minnesota, a partnership. Just a couple things of note. Today marks 1 year since the first patient started to show symptoms. At that point in time, we were scrambling. There were a handful of tests, mostly done by the CDC, to confirm this new novel coronavirus that had shown up months before in Asia and then, of course, in Europe. Here in Minnesota, it was 1 year ago, February 25th, 2020, and I recognize our lives have changed dramatically in that 1 year. At that point in time, we didn't know what we were dealing with. We didn't know how to treat it. We assumed but did not have personal protective equipment to protect our healthcare workers. We were fearful that we'd seen elsewhere hospital capacity be overwhelmed, putting people's lives at risk, both first responders and those trying to get healthcare, whether it be for COVID-19 or whether it be for just the normal things that happen in life. We didn't have the testing capacity, and we certainly weren't even in the beginning of understanding if we could have a vaccine. And during that time, there's been tragedy. 6,450 Minnesotans have lost their lives. 500,000 have had it, and 25,000 have at times been hospitalized from pretty bad cases to life-threatening cases. We've shared that grief. Lieutenant Governor very early on lost her brother. The Attorney General lost his mother, and each of us has a story of loved ones or neighbors or friends who've lost their lives to COVID-19. And then we stood in front of you and asked, let's do this together. Let's fight this thing together. Let's learn what we can do. Let's do the things to slow the spread of this. Let's do the things to protect our healthcare workers, to protect our seniors, and to a time, and I can remember saying this, at some point in the future there will be a vaccine. Well, that point was about 56 days ago when it started arriving in Minnesota. And our case numbers now, and we'll talk a little bit about it, are dropping. They are dropping rapidly. Our death rates are dropping rapidly. And because of what you have done, you've kept Minnesotans safer and you've kept Minnesotans alive. We followed the science. We made tough decisions. I want to be very clear. This has been painful. It has been painful from a health perspective, it's been painful from an economic perspective, and it's been painful from a social and mental health perspective. We talked this whole time about how did we measure the health benefits, the economic benefits, and the well-being, and how did we find that Venn diagram where we got in the middle, where we protected as many people as possible and protected our way of life. We missed holidays, but I'm telling you, we saved lives. One of the things we hear, and I want to just be clear, I talked with a good friend of mine the other night, the governor of Kentucky, Andy Beshear, and he talked about as we measure with states, we've got to get to a point in this country where we realize every single one of our neighbors and every single one of our fellow Americans is part of how we try and reach herd immunity and how we try and protect each other. It doesn't do any good if we're not able to do that. But I just want to be very clear. This shows the rise of COVID cases by states, and it shows our surrounding states. And this has been certainly nothing that people haven't seen. Certain states took certain different steps on this. And I want to show you where those lines start peaking right before you see the yellow line in November. That was in October when we were saying and listening to the healthcare professionals, some of whom you'll hear today, is if we don't change the way we're doing business, we're going to have a spike that is going to overrun our hospital systems. If we don't make a change, we're going to see more deaths. And that's where we started to make that change. That peak did not go as high, and it came down faster, and it's where it's at. That graphic is something that I am proud of Minnesotans. I'm proud of our healthcare professionals. I'm proud of the scientists who made the decisions to make some of these changes, because the higher that line goes, the more people end up in the hospital. The higher that line goes, the more people that die. But here's the deal. It's working. And the vaccine is working, I think, maybe even better than we could have hoped for at one point in time. Cases, hospitalizations, death are at their lowest level than they've been in several months, in some cases clear back to last spring. Long-term care deaths have fallen by 97%. This was the tragedy across this country and across the world, that COVID-19's impact, especially the deadly impact, fell most heavily on our seniors, and it fell most heavily on seniors in congregate living facilities. And we have thousands of those in Minnesota. And 95% of long-term care facilities are not only controlled it, not only reduced their deaths almost to zero, they're open, and the joys of life of seeing grandkids and seeing family members is once again back with them. So what you can see here is this is since November. When we made those decisions and asked you, with the guidance of science, leadership in the healthcare community, to make those changes, this is where things have dropped off. This is where we stand today. We've got nearly 100% reduction in just those 2 short months. That's because of sacrifice that people made, that's because of masking, and that is in no small part because of the vaccine that is there. Whoops. I also in December asked you to make those hard choices to let us get the vaccine going. Remember, it was about the 22nd of December we saw our first cases being able to vaccinate, those that were on the front lines of healthcare and in our long-term care facilities. But I also said the sooner we were able to control the spread of the virus, the sooner we were able to take the pressure off our healthcare system, and the sooner we were able to get as many vulnerable seniors vaccinated as possible, we have to get our students back into school. 88% of districts and charter schools are back in some level of in-person learning. Lieutenant Governor talked about her beautiful little second grader has been back for some time. This week, my 8th grader is back in-person learning. And I can tell you as a parent, life is so much better for them, and it's certainly so much better for us, because we're seeing them re-interact, we're seeing them get that instruction from their professional educators, and the one thing that we all know, that social emotional learning that's part of school is coming back again. We've got a nation-leading education testing program. All teachers have access to on-site testing in their schools every 2 weeks. We're encouraging to get that in the community. It's as robust and as barrier-free in Minnesota as any state in the nation. And we've already vaccinated over 90,000 of our educators who are back in doing that hard work and at the same time making sure they're safe. And here's where we buckle up, and this is the time I would say, I use the marathon analogy. This is time for us to dig deep and let's finish this thing. The end is in sight. We can finish this. We can do it the right way. And daily number of doses administered has doubled since we put timeliness goals in, and our providers stepped up and told us what we needed to do for them to make it so that they could get those vaccines out to people as quickly as possible. We've got a reliable federal partners committed to delivering stable and growing vaccine supply. You heard the announcements, and it'll come on officially here, Johnson & Johnson. Vaccine works. It's 1 dose. It's shelf stable. We don't need to keep it at 90 degrees below zero, which means we're going to have another stream of vaccine coming into the state very soon. So the finish line's there. Let's finish this thing, and here's how we're going to do it, Minnesota. We understood that when we did this, we had to protect our seniors. It means that that commitment has been there from the beginning. It remains there today. 90% of our COVID deaths have come from 65 and older. It's the nature of what COVID does. In 12 months, 1 in 200 people age 65 have died from COVID. It is not the flu. It was never the flu. It was always serious. It remains serious for many people, but those numbers that are most dramatically impacted have been reduced because of mitigation efforts and the vaccine. We prioritize them in the groups immediately for vaccines in January and continue to do so. We've built a network of providers. You're going to hear from them. This is not the state. The state cannot do this. There is a robust ecosystem that allows you to get your vaccine in the easiest way possible. You should be able to get it with your doctor if that's easier for you. You should be able to get it at the local Hy-Vee or the local CVS. You should be able to get it at a clinic that you use, or if any of those things don't work, the state has stepped up and put out pop-up sites and some permanent sites where you can go in and get them there, meaning barrier-free at no cost to you, and try and get you in as quickly as possible. I want to stress, Minnesotans, we can't do it fast enough. I'm on calls about every other day with governors. Every single governor in this country is hearing the same things. Why can't we get it out faster? Why am I waiting in line? Why does it seem confusing? And it's simply a supply and demand issue, folks. We simply, at the beginning of this, we were being told a certain number. It was hard to get stability around it. We had about a 5-day lead time that we could get that, and then we were getting about 60,000 a week. Now think about that number, 60,000 a week, and our goal is to vaccinate about 3.53 million Minnesotans. At that pace, it would have taken us years. It was predicated on adding more vaccines to the system. I'm proud to say now that since the 1st of February, we've been getting a 3-week notice, and each of those weeks has increased in what we're able to get. The minute we're able to increase, our providers have been getting 90% of the vaccines out within 72 hours of when they land in Minnesota. And as you saw last week, if they happen to land in Texas, somebody's going to figure them out in the next 10 hours to get them back to Minnesota and in arms in Fergus Falls and in Thief River Falls and in North Mankato. That's what's going on right now across an entire rich ecosystem of thousands of providers. We've got 43% of our seniors done as we stand. As we speak, that number will kick up, and I believe as we speak, Jan, this will go live on the dashboard for you to go in and see this tick up as we move that number higher. By the end of the month, we've completed vaccinations in long-term care, clinics, hospitals, federally qualified health centers, pharmacies, local public health, and our state vaccination sites all work together. Our site where you can go in and the navigator and find out where you're at and where you can get them, those are up and running. But here's the thing, there's not enough vaccines. There's not enough vaccines still at this point in time. So we have to figure out, but here's the thing that's really great, and the news that we're going to let you know today is, based on the certainty that we're getting from the federal government and how many we're going to get, we can back plan from when the last Minnesotan is able to get their vaccine and back that back up till today and tell you where you're going to fall in that line to get it. And today the seniors are protected and they're ready to go. We will continue to vaccinate, and I want to be clear about this analogy. We're going to continue the focus on those seniors till we hit about 70%. And for some of you who are saying, why 70% where it's at? First of all, we want, and Minnesota is probably doing this better than any other state, that we want everyone to get the vaccine. There's some hesitancy for some people. Some people are not quite certain if the vaccine is safe yet. Some people are going to wait and see what happens. There's always a hesitancy. The idea of vaccinating, we've never vaccinated 70% of people for the flu, but that's the goal we need to get to. So what will start to happen is, as more vaccines come in, and there's fewer in that group, it's going to take a little more time. It's going to be a little harder for some of them to come in. Now, those who are saying, hey, I'm not one of them. I'm 65 and I want it, and I'm waiting and I'm still not in line. You're going to, and that is going to accelerate. We anticipate at the current level where we're at right now, no additional Johnson & Johnson, no additional doses coming in, which there's high probability they will, but our most conservative estimate is we'll be done with that 70% by the end of March. The potential to be sooner is there if the vaccine comes. But I want to be very clear. When we then expand using science, medical evidence, and federal guidelines, it's not as if that group stops. This is a freeway that's being built, and that freeway is running, and we're almost done with the healthcare folks there. The seniors, we're moving up, and we're going to get to 70%. That lane will continue on at 65 miles an hour, and we will merge in another lane because we have more vaccines, and that lane will go on. And as that lane starts to get further down the line, we'll merge more people, and this will accelerate. This has never been attempted in this country to vaccinate this number of people at this rate of speed. It's working. And again, your frustrations is it's not 56 days we've been at this. I wished we would have been delivered 3.53 million doses of this vaccine because I have confidence in our folks. They'll get them out as quick as possible, but that's not how it's worked. We're still manufacturing. Eligibility is going to expand on underlying health conditions and workplace exposure. You'll hear more about that from the Lieutenant Governor and Commissioner Malcolm. And by this summer, every Minnesotan gets a shot. And here it is, folks. This is what we've been waiting for. And I tell you, when I saw this and asked my team to put together a graphic as a Minnesotan to explain, this is when it's going to be done. And if you look at this, this will be on our website. You see on the left side where we've done healthcare personnel, long-term care residents, pre-K-12, and age 65. We're moving towards the completion of that at the 70%, where we will move in folks that are the most high risk. You don't have to be above 65. You can be 42 and have underlying health conditions that put you at great risk. We need to get those folks in. What I don't want to have happen is be sitting on 200,000 vaccines waiting for the final 75,000 seniors, many of whom might be in Arizona yet. I would encourage you to come back to Minnesota, get back here. The weather's good, but they're not. We don't necessarily know that they're there. And those folks that are a little hesitant, anytime you want to come in, those are available for those 65 and above. But we're then going to move to people 45 to 64 with one or more health conditions. Commissioner Malcolm will take you through a little bit of this. 16 to 44 if you have 2 of those, which means your health is more compromised. We'll continue on with the essential frontline workers, people age 60 with living in multi-generational housing. And as you can see, it goes on here. Me, for example, I'm looking at the May-June, age 50 to 64, regardless of health condition. My wife and I will fall into that. Sorry, Gwen. She will fall into that age group, and we will get ours done at that time. My 20-year-old daughter will probably be later in the summer. And what's happened by the time we get into the April and May, about 98 to 99% of the folks who this proves incredibly serious or a fatality will have been vaccinated and protected, and these are incredibly effective vaccines. And so this is where we're at, Minnesota, and I do want to note, this is predicated on our current allocation of vaccines. Everything I see leads me to believe it is not going to be less, it is going to be more, which means the timeline moves to the left and accelerates. And Commissioner Malcolm will talk a little bit about this. In that April timeframe with targeted essential workers, there's some groups that we're going to target because of the risk factors involved in the work that they do that we will move through potentially within 2 weeks and then move to the next one. And so it's just staggered for the ability to get these out based on risk, based on science, and to give you a pretty good idea of where you're going to get it. So if you looked up here, you're 50 years old, you have hypertension, you're one of the 10 of the things that CDC lists that you can get on with one or more of high-risk conditions, you're looking at sometime starting in April, and again, potentially if this thing moves faster, move back a little bit more. So it's an exciting time, Minnesota. We've got work to do yet. We've got a lot of people to thank. There's going to take some patience to get there. But as you can see, and we'll quickly in the near future here follow up, you can start to extrapolate from this, as I saw on the front page of the paper today, and I'm just going to name it, the thought of walking down those streets at Dam Patch Boulevard with a corn dog in my hand is like the happiest thought I can imagine. That is within our reach. That is within our reach. If we do things right, we continue to accelerate. That's the type of thing that we have to look forward to. And so I always look forward to getting a chance to introduce Lieutenant Governor Flanagan. Again, I would announce the Lieutenant Governor has been deeply personally engaged in this, from the loss of a family member to also having a little one trying to get back into school, and brings that perspective, a leadership perspective, and also I think in our administration, someone that makes sure that every single Minnesotan, black, white, brown, indigenous, does not matter, has an equal opportunity to receive the vaccine and the care that they need. Lieutenant Governor Flanagan. Wipe that off for you.
Thanks so much, Governor. And I, too, am looking forward to corn dogs and cookies and being with Minnesotans at our most favorite event. So good afternoon. As the governor said, when we say that we are focusing on all seniors, we mean all seniors. That means seniors of color, that means Indigenous seniors, that means seniors coming from every single part of the state. Minnesota is undertaking ongoing and constantly evolving efforts to ensure that every Minnesotan has fair and equitable access to the vaccine. We know that many of our communities, particularly our Black, Latinx, Indigenous, and Asian Pacific Islander communities, face unique barriers in accessing the vaccine. We also know that these same communities have been disproportionately affected by the pandemic. As more doses arrive, we are working with community pharmacies, federally qualified health centers, and local public health agencies to expand access. We aim to deliberately and strategically provide vaccine access to Minnesotan communities disproportionately impacted by COVID-19 as a result of systemic inequities that exist in our state and in our country as a whole. Minnesota's federally qualified health centers are a core component of our efforts. Many FQHCs are centrally located and serve our focus communities across the state of Minnesota. To date, we've been able to deliver FQHCs every dose of the vaccine that they have requested to vaccinate their senior populations. So how are we going to reach Minnesotans? You've seen our efforts so far, but our administration has created several equity-focused initiatives to ensure accurate information about vaccine safety and availability to our focus communities. Last week, we launched our Minnesota COVID-19 Vaccine Connector. Using this tool, Minnesotans can fill out a simple form and receive updates about their vaccine eligibility. When you are eligible to get the vaccine, there's an opportunity in your area. We're going to let you know and we're going to notify you. A prime example of our commitment to continuously engage with Black, Indigenous, and people of color communities is the expansive on-the-ground work of our COVID-19 community coordinators. In addition to being a reliable source for accurate information about COVID-19, our CCCs, as we call them, are working hand in hand every single day within their communities to help those suffering from the impacts of COVID-19 to connect with resources that can help them with issues like food access, housing, childcare, and legal matters. And we're partnering with over 30 organizations across the state to ensure we're addressing the needs of our BIPOC communities. There are really amazing examples of innovative partnerships that are happening all across the region. So for example, we are partnering with the Stair Step Foundation, working to distribute information about the vaccine. And in partnership with mHealth Fairview, they are hosting weekend vaccine clinics for seniors at Black churches. We also know that different communities bring different questions and concerns about the vaccination to the table. So that's why we've partnered with organizations like HACER, the Hispanic Advocacy and Community Empowerment through Research, who can respond directly to directly in the language Minnesotans feel most comfortable speaking and share trusted information about their concerns. And we will share critical information about COVID-19 vaccine access as widely and as we possibly can. The Minnesota Department of Health is partnering with 30 diverse media outlets across the state that serve communities of color, American Indian communities, LGBTQ+ communities, and disability communities to ensure that folks get factual data about vaccines and actionable information for Minnesotans seeking the shot. We want to make sure that it gets to the people who need it in the way that they can hear it with credible messages and credible messengers. We are incredibly aware that there is always more that we can do. There's always more we can do, but we are committed to working directly with our partners and with communities that we serve to ensure a safe and equitable vaccine rollout. To Minnesota's BIPOC communities, we see you, we value you, and we want to ensure that you get the vaccine, and we're working to make that happen every single day. And one of our champions who's ensuring to make sure that that happens is our incredible health commissioner, Jan Malcolm. Jan. Clean that up for you.
Thank you so much, Lieutenant Governor and Governor. Good afternoon, Minnesotans. This is indeed a good day. We're here to talk about some specifics about how all of us can look forward to getting the vaccine. I'm going to spend just a couple more minutes giving you a little bit more detail about the stages and the groups that will be coming eligible very soon, so all of us can see ourselves in this process. As the Lieutenant Governor just so eloquently said, we are simultaneously working to speed up the vaccine distribution all across our state, immunizing for impact, still paying attention to where risk is greater, where outcomes are worse, and doing this all through a lens of equity, recognizing that the burdens of COVID have not fallen equally on all of us. So after seniors, the next phase is going to protect Minnesotans at higher risk of exposure and severity of illness. This path is based on evidence and on guidance from the federal government and from a deep partnership with our healthcare providers here in Minnesota. So beginning in April, now the governor mentioned that we anticipate being at least to 70% of all people 65 and older having been vaccinated within the next few weeks by the end of March. Reminding you again that that takes care of the population that has suffered 90% of the deaths in Minnesota and over half of the hospitalizations when we get through that 65 plus population. But moving on, it's very important to also acknowledge that there are some conditions that have particularly severe complications when combined with COVID. And so the people who are vaccine eligible age, so 16 plus in the case of the Moderna vaccine and 18 plus in the case of the Pfizer vaccine, will be eligible above that age if they have sickle cell disease, Down syndrome, are in active cancer treatment, are immunocompromised specifically from solid organ transplants, or are oxygen-dependent chronic lung and heart condition sufferers, so conditions like chronic obstructive pulmonary disease and congestive heart failure. Now, this group of people accounts for 75% of the deaths in Minnesota have been associated with these conditions. So with the combination of age and conditions, we are talking now about reaching and protecting the most vulnerable people in these first waves. In addition to this very specific list of people with these specific conditions, we will also begin vaccinating the targeted essential frontline workforce that the federal government has identified. We'll begin in the April timeframe with food processing plant employees specifically. As you might remember, around the country and here in Minnesota, these were some of the largest and most severe outbreaks that we saw. And we know that the population working in these plants are significantly BIPOC community members and people living in multi-generational households. As well, this sector is incredibly important as we are one of the major producer states. The food supply of the entire nation relies on us. So there are many reasons to prioritize this group. So that's, and as the governor mentioned, these are both kind of defined populations, and it's only going to take us a matter of weeks to get through vaccinating these groups at the current supply rate, while we continue to vaccinate seniors as well. In April and May, then, we will further expand to more people with high-risk conditions, so a slightly broader set of conditions, and this will be age-based. So 45-year-old to 64-year-old people with one underlying condition on the list that the CDC has developed, which some of our clinicians can also speak to in a moment here, or people 18 to 44 with two of these underlying conditions, because we know that age and conditions and multiple conditions also increase the risk. We'll also, in this time frame, be expanding to more essential frontline workers in the sectors, again, defined by the federal government as being frontline public-facing workforces. As well, people 50 years and older living in multi-generational housing will be vaccinated in this same time period. So April to May, very large groups of population, but by this time we will be having significant increases in the volume, and we'll be able to get through these populations in a matter of sometime in this April and May timeframe. In May and June, then, additional Minnesotans will become eligible through either an age or a health risk perspective. So anyone 18 and above with any underlying health condition of concern, or anyone age 50 to 64 who's not yet been vaccinated, will be vaccinated regardless of health condition just because of their age cohort. At the same time, all the remaining essential workforce categories that are not particularly public-facing but are defined in that essential to kind of societal and economic function will be vaccinated. So by this May-June timeframe, we will be to the point where we're able to open vaccine to all Minnesotans, having worked in a systematic way through those at greatest risk of severe illness, hospitalization, and death. And with that, I'm very pleased to introduce Dr. Abe Jacob. And Dr. Jacob is from mHealth Fairview.
Thank you, Governor, Lieutenant Governor, and Commissioner Malcolm. Really happy to be with you. I'm Abe Jacob, Chief Quality Officer for mHealth Fairview. I am proud to represent mHealth Fairview and a remarkable team that has been a voice to the remarkable work for all that we've done to care for the ill, to heal the sick, and comfort the grieving. We still have a lot of work to do, and I want to thank and acknowledge all of the healthcare workers that are out there today still caring for our COVID patients. We have been shifting over the last 8 to 10 weeks from caring for the sick to ending the pandemic through vaccination. The data is clear, and looking at the data from in the Health System Coalition, we know that the pandemic has disproportionately affected certain populations: the elderly, those with chronic underlying conditions, BIPOC communities, and our essential workers. And that's where we focus our data and science, is addressing those populations to end this thing. We're already starting to see the effects of that. We're seeing the rates of death go down. We're seeing hospitalizations come down. And eventually we will continue to see rates of infection go down. That's the power of vaccination, and it has been a better and better day every time we look at the data. I'm really proud to be a part of a health system coalition that has collectively looked at this information together. We've been focused on the data and the science to focus our vaccination efforts. We are on the cusp of ending this pandemic. The news is only getting better every day. And I just want to say it's going to be a beautiful spring in Minnesota. And with that, I want to introduce my colleague, Dr. Amsbury.
Thanks, Dr. Jacob. Good morning, or good afternoon now. My name is Dr. Jill Amsbury, and I am a pediatrician at CentraCare. Over the past 6 months, I have been working at a local, regional, and state level on COVID vaccine planning and distribution. The people on this planet have had a hard year. We have had changes at home, within our families, and in our job settings. We have seen loved ones suffer and die from the disease. But because of vaccination, we finally have hope in the midst of hardship. And we are excited that so many are interested and ready to receive the vaccine. That's a good sign for our communities and our state, because we still need to come together and get our state vaccinated to stamp out this disease. We've always known that there would be challenges with vaccine supply in these early stages. The greatest challenge we've faced thus far is that there are just more people prioritized than we have doses to give. So in healthcare organizations like ours, who care for such a large geographic area and rural population, we really rely on all healthcare systems and everyone in the state working together. Our healthcare system collaborates with other healthcare systems in the state, regional coalitions, MDH, and local public health to get this work done. Everyone is working as hard as they can together to distribute the vaccine. But it is extraordinarily challenging when vaccine availability is scarce. If we become too granular in our allocation decisions, we won't move through this vaccine administration fast enough, and less doses will be given to the state of Minnesota. And at a time when we are continuing to see people die of the disease, though better, along with a possible race against time with these new, more transmissible variants, speed of administration certainly must be considered. But we cannot ignore our ethical principles that have guided us along the way. All along, we have tried to balance reducing morbidity and mortality while preserving societal functioning. So in these coming phases, the plan is really to focus on age, individuals with underlying medical conditions that may put them more at risk, and frontline essential workers. And we also know that racial and ethnic minorities are disproportionately affected by COVID, as you've already heard. We need to ensure that we don't further these disparities along the way. In order to mitigate the virus, we also need to mitigate these health inequities. So we parallel speed and equity in an effort to truly do no harm. CentraCare has an equitable vaccine distribution team that has been meeting with community leaders on a weekly basis to listen and understand concerns, while also helping to answer questions. We are working on reducing digital, language, and literacy disparities by developing different workflows for our patients to get scheduled. And early in the vaccination process, we met with local racial and ethnic minority leaders to share our excitement about vaccine availability. But they were understandably hesitant. This gave me a better perspective around the bridges that needed to be built, to establish trust and relationship with these leaders, and to use their channels of communication to reach their communities. Our minority partners have told us that they would like to have vaccine education come from someone that looks like them. So we are identifying community champions to help inform and educate. And we have heard that many would feel most safe to receive the vaccine if we would come to them. So we are expanding our work to take vaccine administration outside of the healthcare system walls. Since the beginning of February, CentraCare has been working with MDH to target populations in need of COVID vaccine but are harder to reach. We have a mobile strike team that focuses on communities that, because of various reasons, like lack of mobility, may not otherwise receive the vaccine. This team covers a 38-county area and has helped vaccinate people from Moorhead to the Twin Cities. People in low-cost housing, homeless shelters, assisted living facilities, and even the St. Benedict's Monastery in St. Joseph, where the sisters sang a blessing and said a prayer before receiving the vaccine. Those hundreds of people would not have had access to the vaccine had we not brought it to them. That's work that we are committed to seeing through. We have all made sacrifices over the past year, and those sacrifices have mattered. We have saved lives together as community members. We know people are tired because we are tired too. But if we give in to this fatigue, it will put us at risk of letting our guard down and not keeping up with the action steps that have brought us to this point. Thank you all for your unwavering patience as we continue to work through this incredibly complex process. I cannot wait for all Minnesotans to have the opportunity to walk into a vaccine clinic for the first time, wherever that clinic may be, and receive their initial dose, to feel that feeling of hope. We look forward to continued collaboration with the governor, Minnesota Department of Health, our healthcare systems, and providers all across the state to save lives through vaccination. And with that, I will turn it over to one of our healthcare partners, Health Partners CEO, Andrea Welsh.
Thank you, Dr. Amsbury. I want to thank Governor Walz, Lieutenant Governor Flanagan, and Commissioner Malcolm for your partnership to get Minnesotans vaccinated as fast, safely, and equitably as possible. At Health Partners, we know how important it is to offer vaccination to every Minnesotan, and we know what a hardship and what a toll COVID-19 has been on Minnesotans, our families, businesses, schools, as well as our healthcare systems. We're proud to be part of a 10-system coalition, a consortium dedicated to partnering with the state, regional coalitions, local pharmacies, and public health to get vaccinations done as fast, safely, and equitably as possible. Supply of vaccine still needs to catch up, as you've heard today, but we're making some really important progress as a state. We appreciate that the governor has sought the combined clinical and scientific expertise of the Minnesota health systems, along with that of the CDC, in setting out today's new guidelines. We hope that supply will allow us to move fast and to meet the timeline that was outlined today. Our health systems are working hard for what we all want, every Minnesotan vaccinated as fast as we can, and we will get there. We've seen really good progress, as the governor noted, in the last couple of weeks, and there's good reason for optimism. As we make our way to the day, all health systems are making a top priority limiting death and hospitalizations from COVID-19. We're making headway in vaccinating those most at risk, our oldest Minnesotans. As the governor noted, today over 43.5% of seniors over age 65 have been vaccinated. We've made great progress. As the lieutenant governor noted, we've also focused in our system consortium on making sure that our elderly patients from communities of color are reached out to and ensured that they get access to vaccination. We know within each of our 10 systems that may take some special outreach, and as Dr. Amsbury shared, we're taking those steps because we know the risk and the health outcomes necessitate that. And we're happy about the progress we're making, and we would be the first to say there's so much more work that needs to be done. Our hope is that vaccine supply will continue to open up, and we have good reason to be hopeful with the Johnson & Johnson vaccine approved just yesterday. Every day, we're adding more clinical reinforcement to what we already know. These vaccines are safe and they're remarkably effective. They're making a real difference. And as a coalition, we're ready for more. We're currently administering about 7,800 vaccines a day, and we've got the capacity to administer 20,000 a day currently. And if and when that highway opens up and we can get access to more, we could double that yet again. So we are ready as a state to take as much vaccine as we possibly can get. Our infrastructure is ready, and we will continue to focus on working closely with the state to do everything we can to get access to more vaccine from the federal government. Every stage of this pandemic has been difficult, and there haven't been a lot of simple answers to the challenges that we've faced. But partnership has continued to be our way through. Today, I'm grateful to the health systems of Minnesota that have come together as one to bring our best thinking to bear on behalf of every Minnesotan. I'm also grateful to the governor and his team for our continued partnership. We're making great headway, and the health of Minnesota is at stake. So thank you.
It's a good day, Minnesotans. I want to thank our partners. I've been asked before, who am I listening to when I make these decisions? You're seeing some of them. These are folks who've stood with me on days that weren't so fun, when we asked you to slow or shut your businesses, when we asked you to change your holiday plans, or when you had to tell your kids they weren't going to be able to play that basketball game that they wanted to play with their friends. Those have been hard decisions, but they were based on science and they were based on saving lives. We've had many conversations. Andrea and I have spoken on Sunday mornings and spoken on Friday nights. And as it should be in a true partnership, she's told me what I needed to hear, not what I wanted to hear. And we've worked together, and when we needed to, we pivoted and changed, all with what was right for Minnesota. I value this partnership above anything else. You can't do this alone. This is a massive undertaking. There are now literally thousands of locations where people will get their vaccines. The one thing I will say is I'll be happy with Johnson & Johnson when I don't have to worry that it stays at 90 degrees below zero. But these vaccines got out there. They made a difference. There's numerous ways that you can get them. So Minnesotans, here's where we get to go. By summer, every Minnesotan is going to be eligible and get their shot. I want to encourage you to do so. Please get information, and I think Lieutenant Governor stressed on this. Go to validators you trust. Go to people in the communities. Stair Step Foundation and Reverend Babington Johnson, those folks understand. They're trusted leaders. They'll be there with the vaccines. We're going to ask you, if you're young and you're healthier and you can work from home, wait and let some others in line. Just do that courteous Minnesota things and let a few others get in line. Your time will come up, and it will come up faster than you think. We know there's a lot to ask. This commitment has been tough. It's told us a lot about ourselves, and I, for one, am incredibly proud. I'm proud at one point this week, we're delivering vaccines. These people, this network's delivering vaccines faster than 41 other states. And I'll tell you, when all of this is said and done, Minnesota, right at this point in time, in deaths per 100,000 on a per capita basis, we're 35th. Every death is too many, but decisions were made that protected lives. Hard decisions were made to protect lives that each and every one of you listening made. And it was implemented by our frontline healthcare workers. And remember, there's folks that have been doing this basically with no time off for an entire year, just like you have, been in the house. This week, I cannot tell you the joy of watching a 14-year-old eighth grader get to go back to his school and see his friends that he's not been with for 365 days. It has changed our life. It has changed things, and I hope each and every one of you are experiencing some of those things, and it's only going to accelerate. So again, it wouldn't be time with me if I didn't have to go through a little bit of it here. Like many of you, we have tried to be as transparent as possible. I've been with you a lot. I'm sure for some of you, you have seen me too many times, and you're not certainly appreciative of that. But it's always been to try and give the best information. Track your status of where you're at on the vaccine connector. I would ask you to use download the app that lets you know if you've been exposed or next to somebody. It's all the privacy data, and we've got, I think, nearly 1 million Minnesotans using that right now. If you're eligible, find that locator map and get your vaccine in. In the meantime, mask up, social distance, get your tests. I'm going to end with this. We have the most robust testing of any state in the nation. It's free, it's barrier-free, and with the variants that are out there, it may be more important now than it's been at any time during this pandemic to get tested and try and isolate this. This is a combination of things with the vaccine that will accelerate that. And as you heard each of these medical folks talk about, if we can shrink the number of folks getting it, that is just simply all of those days are wins. So we're going to do this. We're going to roll up our sleeves. We're going to whip this. Get your vaccine now. Every shot that's administered is one day closer. And the next few months, things are going to start to return, hopefully better for so many of us. And let's us celebrate those things we want to. I, for one, read an article that talked about the spectacular summer that's coming. It is nearly here, Minnesota. So do the things that you can do. Pay attention to when it's your time to go. Help get folks on there. We asked, and I appreciate some of our physicians say, we're going to need a little bit of patience here, but the good news is after the next several weeks, we should start to see even more of an acceleration and get closer to that. So we're going to go over and take some questions from the media. These sites are available for you. Get on, inform your neighbors, talk to them about what's going on. But Minnesota, this is the press conference on COVID that many of us have been waiting for. I, for one, am never going to be able to thank Jan Malcolm, Lieutenant Governor, the entire staff of the Minnesota Department of Health, and so many others of these folks that are out there as public servants doing the work, and now finding how strong we are when we partner with our private sector and our nonprofits. We can make a difference. The history is going to be written about this pandemic, about the 2020, the 2021 COVID-19 pandemic. And it's going to be the heroic stories of how we whipped this, saved lives, and lessons learned from it. So thank you, Minnesota. We'll be back soon.